and you're listening to Mental Breakdown.
So, Chantal, I'm so excited that we're doing this today. I'm also so excited that ASU matched us about a year ago for you to be at my site for your internship.
I know, me too. I feel like there's a lot of fun things coming up on a year for us to get into and talk about too.
I know, it's crazy.
It is crazy. Time has flown. And they said that in the program.
Yeah.
They're like, it's going to fly. And then when you're starting, you're like, oh, it's going to be a long time until December or January. And when you're in it, it's wild.
Well, and I'm sure like the first probably like couple months felt like either like you were drinking from a fire hose or it was taking forever or maybe both.
I know. I felt like, and I feel like when we did having our conversations before like my first official day, because I feel like that was the biggest thing, at least in my cohort, of like, what's the first client going to be like? What's it going to be like to have the first day where you're actually in the chair, with somebody? There was a lot of anticipation with it, but I feel like because we talked a lot about what the process would look like, and you were so good about, I remember you told me this, and Lucy and Adia and Darcy told me this too, of like, your job in the beginning is just to be present and explore getting comfortable and making sure that your client is comfortable. You're not gonna fix the world's problems day one.
I mean, I wish we could, but
I know, me too. How nice would that be?
I mean, we would charge a whole lot more for sessions and we would all be retired on a beach somewhere. So,
right.
Or I would be. You guys are welcome too, but
yeah.
but I do think, the wanting to like have clients change immediately and like really be that force of change or that guide of change. I think starting out it's like a pressure, right? It's like, okay, how can I help this client like feel better day 1 or day 2 or day 3? And so we do put a lot of pressure on ourselves to be the best therapist, give them all, the tools, the tricks, the healing that we can do. But from day 1, probably not going to happen.
Right. And so I feel like that was something where everyone tells you in grad school, like, you're going to want to get in there, start using interventions like soon. And you kind of have to resist that feeling of wanting to jump in or want to like pull out all these handouts and use a ton of psychoeducation. And I feel like that's something that you can't really understand the value of it until you're in the room and you're doing the assessment. And so I feel like once I was able to have that first session and really like get in the groove of what this role is, not from a theoretical standpoint of what we like practiced in grad school in our tiny little rooms, but like what it feels like and how people are so like wanting to do the work, but you have to slow down in understanding. And I think for me, like the biggest learning was how valuable in practice the assessment sessions are.
Yeah. And I think learning like what to ask,
that was another big one. Yeah.
And I think in the beginning, like starting out, like I remember, and granted I've been a therapist for like a century at this point, but like being so nervous to like ask about like sexual abuse or, physical abuse, like abuse history, trauma history, things like that. Or even like, is a client suicidal? Have they ever been suicidal? Do they have thoughts of self-harming? And like, oh my gosh, like, am I going to offend them if I ask them this question? And so kind of finding like your own way to ask about it and to join and build rapport so that you can.
And so they feel like, okay, this is part of the process. And that was something I feel like you said to me too, of you are in there like leading the space. So if you ask something that you're like kind of hesitant about, or like there's like body language to it, or you have a certain connotation, that could make it seem like it's like a taboo thing or not something that's, space is held for. And so I think just also kind of owning like this is part of the process. And if you lead in a way of asking questions where it's, part of every assessment process, or you're leading in a very curious manner, it's going to help people open up a lot more and give you a lot more information where it's not feeling as nervous.
Exactly.
Yeah.
Well, I would say be a human first and a therapist second.
We need to make shirts with that.
We can make shirts with that. I will
I think
put
that'd
my
be
husband on that. He's currently doing something for Elizabeth for one of her events, so I'll put it in line after that. So,
Okay, perfect. Steve knows what to do.
but it really is, and I know we've talked about kind of the difference of being at a private practice for internship or as an associate versus community mental health, like an agency or something like that. And so I really feel so fortunate with the clients that we get in our practice because we have such good humans that come in. And not
We
that there
really
aren't good
do.
humans over there, like the community, like agency or anything like that. It's just, it's a different vibe where
Hmm.
most of the time, and let me know if this has been your experience, but I feel like 98% of the time clients come in and they want to work and they're motivated and they're open. There's a couple that are like, I'm here because like my parent wants me to be here or my partner says I need to do therapy. But we get clients that are really motivated and they have a relationship with us where, granted, it's professional, it's therapeutic,
Hmm.
but they care about us. It's like they ask like, how was your weekend? How was your vacation? How was your time off? Like, how's everything
Yeah.
going? And so, there is that like human connection before we start throwing interventions at them left and right.
Right. And I think it's been so beneficial for me to experience that element of it too,
Hmm.
of like our clients are people as well,
Yeah.
and they want to connect with someone that they feel really comfortable with
Yeah.
and naturally are going to like be invested, in some capacity in our
Yeah.
lives, like very much in a professional way. But I think that also in the private practice sphere, what I'm hearing a lot from my cohort and just hearing other people's experiences across the board is, as you're developing your style as a therapist in a private
Hmm.
practice, part of why they continue to see you is not only like of what you're doing to help them with some of the interventions, but like who you are as a person.
Yeah.
And so,
Hmm.
like what you said earlier, like we're humans first. I think we like, as a newer therapist, like that was something I was grateful to have the context of early was like, I don't want to rob myself or like my clients
Yeah.
of having like an authentic connection out of, trying to be like this therapist that I really admire, like trying to be
Yeah.
my supervisor, trying to be someone I work with. And
Yeah.
so that was big for me too. And I feel like early on, like one of the fears that I got a lot in my cohort that we talked about is like, okay, what if you meet with someone and they decide a couple sessions in, like, they're not vibing with you?
Yeah.
Like, yeah, it doesn't make sense. And I feel like there's a lot of pressure as an intern to know, like, I feel like no supervisors have said this to anyone of like, you need to keep like every single person you do an intake with.
No.
But no,
That
you
like
were
in
like,
my whole body, like a whole
yeah,
reaction. Did you see it? I was like,
I
no,
did.
like
It's so like not, yeah, especially you. I feel like you were like, no, like let the
yeah.
process unfold and
Yeah.
like let people figure out like if you're the right alignment, and if you're not, that doesn't mean you're a bad therapist. And that is a hard thing as a new therapist, I
Yeah.
feel like to sit with.
Oh, for sure. And even as like an old therapist, sometimes it's hard to sit with because I'm like, what did I do? Like, where did I mess up? And I think, and not saying that I'm like the best therapist because I still have a lot to learn and growing.
You're amazing.
No.
Yeah.
But I think, there are going to be times where like I make a mistake or I get something wrong or like we had a couple that we saw that I got fired because they didn't like that I was direct and I
Mhm.
wasn't going to play this like gaslighting game. I don't know how else to describe it. And so I got fired for that. And I think I told you, I'm like, Chantal, like I'm probably going to get fired between 4 to 6 sessions because I can already feel like one of the partners didn't like the way that I wasn't just completely enabling them.
Mhm.
But, it still sucks. I mean, there's part of me like I knew it was coming, but I'm like, oh, it still sucks because like I really thought we could do good work with them, but
I think that's what it is. It's like less so because from what we've talked about, it's like I don't think it's not as much like an ego thing of
yeah,
like, oh, like they didn't, like us or whatever. It's more like I know we could have done the deeper work and it would have been really impactful, and we have to just like
yeah,
honor their choice, to
yeah.
find a different resource for them. So I feel like that can be part of it too. But I think as like an intern, having a supervisor in a practice that is very open to just like allowing the process to unfold naturally and it not being so transactional. You know, of like what the client needs, how retention's important, of course, but also going with like what the client needs.
Oh, for sure.
It's a lot, of the pressure off of like, okay, what's going to happen is going to happen, and I'm going to be my authentic self. And
I love
and
that.
the people that want to stick around and like work, that's great. And if not, like that's okay too. And we can't be a therapist for everyone. And that's also something hard for new therapists, I think.
We should not be a therapist for everyone because that means we're not being authentic. You know, and you said something just a minute ago of like what's going to be best for the client, but it's also what's going to be best for the therapist because, you know, you talk a lot, not you, but like grad school and community, like continuing education and all that. Like that's the you I'm talking about. You know, talks a lot about countertransference where, you know, we're going to have clients are presenting concerns, you know, disorders, different things that clients are working on that either doesn't like align with what we've been trained in, or maybe sometimes is like too close to home. And so being able to even have that kind of like check in with ourselves of like, okay, is this a client that I can hold space for? And if not, that's okay too. You know what I mean? And we've had conversations like that, like as a practice of, you know, how do you feel about this client? Or, you know, how do you feel about this presenting concern, you know, or and things like that, especially in an internship where you're getting like all new things kind of thrown at you from, you know, kids to adults to families to couples to all of the things. And so constantly checking in of like, how am I feeling with that?
And that was a big one too in grad school because so many people are like, okay, how do we determine, obviously the presenting problems that are more like technically out of scope of competence are a little bit easier. Like we at our practice don't treat active eating disorders. And so, you know, that's an easier one for us to provide referrals for. But I feel like there's all of these gray areas where you don't know until you're in it of like, okay, like this, we could branch off and it could be something more intense or it could be something that's more manageable. And it's just having to like constantly reassess in supervision and just like check my little therapist gut of, am I the best resource and do I have the right tools for this person or do we need to look at like a different course of action?
And I think that's hard, you know, going back to what you said of like, I want to be the best therapist for everybody. You know, sometimes it is being able to say like, I don't think I'm the best fit for you and here's why. And sometimes it's easy, like you said, with the scope. And then sometimes it's like, man, I really like this client, but like, I don't have any more tools in my toolbox.
Right. And like being aware of that. And I think that was something going back to like the informed consent. That was another big one in grad school where it was like, there's so many things that we have to like get to in the first session. And it can like feel, I remember like doing it before I was practicing it with someone in my cohort and it feeling a little bit more like, all right, I got to make sure I get all this and totally get in like a groove after. But something that I didn't start like really hitting on until I think until we had that family that we worked with where there was a lot of illegal and court involvement.
Yes, that was a great learning experience for all of us.
It really was. It really was. And I know we talk about this, but I'm like, I'm so grateful that like I got that experience early on in my internship because I think what it showed me is it is so important in the early stages of like kind of setting the tone of these assessment sessions are for, you know, you to get a good feel for like my therapeutic style, how you feel in the room, as well as for me to ensure like more about what you're focused on, what your goals are. And if at any point, you know, we decide that there's not that alignment for a, you know, a reason of comfortability or more so like, I'm not the best resource for you and here's why. No, we're going to have that conversation. And I feel like that's something where now, like, as I noticed with a couple of the intakes I even had last week of, like, opening up that conversation, there's such, like, an energy for the client, too, of, like, okay, like, I get to be vocal about things that I like or things that I want to change. And, like, this space is for me, and they're not surprised if something happens down the line.
I hated that that was one of your first experiences with the practice, that
Wait, I
family.
like loved it.
I
I
was
was
like,
like,
oh my God, I'm like the worst supervisor. I gave her this like this family and now it's like escalating and I felt so bad. I was like, oh my gosh, Amanda and Darian are gonna like kick me out as an internship site and I'm gonna get
never.
like a bad evaluation from them. Like I just went down this whole spiral of like, oh my God, like that was so bad for Chantal. Like I felt so bad.
No, it was like such good experience. And I feel like even as I prep for the national exam
Oh
in the new
yeah.
year, there's a lot of questions that I feel like in
Mm-hmm.
private practices, most people don't get exposure, depending on the practice, of course,
Yeah.
of like making, those DCS reports or like having things escalate and like
Yeah.
really knowing what our role is when there's, a custody
Yeah.
disagreement. And so that actually I feel like has been really helpful for me in knowing and also having the discernment
Mm-hmm.
of some of the questions and like documents to ask for on the
Yeah.
front end whenever there's like a divorced family involving children and all
Yeah.
of that.
That was a wild ride.
It was a wild ride. We learned so much.
We did. I didn't want to learn anymore at that point, but the universe was like, just kidding, here we are.
You're
So,
like, no more lessons. I'm good.
but as a supervisor, it definitely was a learning experience for me too of like, okay, where do I need to tighten things up with informed consent, with documentation, with, different things like that. Um, and so I'm like grateful for the learning experience, even though I didn't want it.
We wouldn't have requested such a thing, but
No.
we are making meaning. And we move on.
Yeah, we do. And then every once in a while we go back and then I'm grumpy like this and then we'll move on again. So,
And then we move on, but we reminisce and we learn. I do
yeah.
feel like it was such a good learning experience for me. And we handled it, I think, also seeing you, Manon, go through like ethical decision making and
I know. I'm not making the face at you. I'm just making the
I
face
know.
of that whole thing because I was like, to be honest, like there was probably like 6 months that I'm like, I'm gonna get a board complaint. And I'm not gonna what? I don't want that. Okay, I'm not getting a board complaint. But I was like,
You're a very ethical woman. There's no complaints happening for you. No.
Well, I was so worried that like one of the parents was gonna do it, just given like the high conflict and everything like that. And I won't go into more details because I don't want to identify anything. But I think there was like a good 6 months. Like I went to bed and I did like my like manifestations and my mantras that were like,
Yes.
I'm divinely protected personally and professionally. Like my people are divinely protected personally and professionally, and just kind of like calling in like divine protection because I was like,
Calling in all of the protection. Yeah.
I was freaking out. And then the lawyer that I hired to like just kind of like help me with like what do I do and like how do I draft this and whatever. He was like, "Oh, you're for sure getting a board complaint." And I was like, "That doesn't help." Like
He's perfect. This is great.
and I haven't, knocking on wood. So
And you won't. You really like handled it so well, and there was so much due diligence done on it. But I think like that experience also as an intern, something that I don't know if it was talked about like as much in my cohort was when you're navigating with like kids and families, like really kind of reining in and setting expectations for parents early on.
Yeah.
And that can feel, at least for me, there were moments because I was like, oh, I love working with these kids, and I like am so excited to help the family, and I know that everyone means well. It's sometimes how things are presented or certain things that are said in like parent sessions, where for me as an intern, that I feel like took a little bit more time than I was expecting to get in a space where I was like, okay, the parents at times in certain scenarios are like viewing me as an extension of like the child, boundaries that they have, of they can be like more direct in saying how they, exactly want things to go, or things that they absolutely don't want. And part of what I feel like was really helpful with that family, as well as other families just since then, is like really kind of like honing that role of as the therapist of the family, and being able to like describe to them and like hold space and listen, when of course they want things clarified or are curious about like where we are in the process, but also not just like be appeasing for appeasement's sake to like keep the parents you know, like
Yeah,
happy
and I
would maybe
think,
the thing. Yeah.
and it's hard when you're a newer therapist, I think,
Yeah.
like an intern, like you're brand new and you're great. Like you're such an old soul and like so clinically good. But just that developmental piece of, okay, well, can I make this recommendation or like can I set this boundary because like what is my role? And especially when like here's what I think it is, but here's what the parents want it to be, but here's what the Board of Behavioral Health says that it is. And so trying to like
Right.
navigate all of these different systems. And I think you've done a really good job with that.
That's very nice. Thank you. I get a lot of your help and
That's what I'm here
everyone's
for.
help with the practice. Yes, that's
Yeah.
what we're here for, which is so important. But I think that that's something of just like
Mm-hmm.
as an intern, like it's been so cool for me to see that process as I work with more
Mm-hmm.
parents and like merging the kids' goals and the parents' goals and families
Yeah.
are something I'm actually, I think, like very interested in continuing, like as I,
Mm-hmm.
develop after my graduation and things like that. And so having those experiences where I'm able to like work with clients in that way has been really like a good challenge,
Yeah.
but something that I don't know if the grad school role plays can necessarily prepare you for.
I don't know that any role plays prepare, like even with like I'm thinking of like EFT. Like, so I've done
Yeah.
advanced EFT training where we have to do role plays, so we have to practice being the clients and being the therapist. And I'm like, this is so fucking cheesy. Like it's just so cheesy that it's like I can practice the techniques, but this isn't how a
Yeah.
client's going to show up in session 100% of the time.
Right. And so just kind of taking it of like, okay, and I feel like the favorite phrase of all my grad school professors is it depends. And
Oh,
when you're in school, it's like, oh, but what about like you want to get specific and then once you're in it, you're like, it really does depend. Like it
yeah.
really you got to be adaptable in that way.
Yeah.
So I'm curious, like for you, Manon, because you have had so many like amazing interns. We love everyone at
Well,
our
three.
practice.
You,
Three,
Adia, and
amazing.
Lucy. So,
Yeah, and they're wonderful and perfect.
yeah.
They are wonderful and perfect.
And
And
you're
like for
wonderful and
you,
perfect, and we have such a good vibe as a practice. So, anyways, keep
we
going.
do have such a fun vibe. Like, it is such a fun vibe.
Yeah.
When I'm like, whenever we have to do debriefs in my practicum, I'm like, I'm having so much fun.
Yeah. We have a fun group.
We really do. But for you, like, because I feel like also I have a couple of friends that are LA MFTs
Mhm.
or practicing just at different parts in the valley, and our practice really is like quite unique in terms of how collaborative we are and just
Yeah.
like genuinely how supportive. And I feel like that's a very big thing that I'm grateful for as an intern of like how specific and how like intentional you are about how you built your team and like what
Mhm.
you look for in interns. So from your perspective, what do you feel like were the main things like characteristics wise that were important to you with an intern?
Oh, that's a great question. A lot of it was, are they going to fit with the culture of the practice? Are they going to vibe with everybody that's already here?
Mm-hmm.
Are they open? Like, are they open to feedback? Are they authentic? Like, are they honest? Like, those are things that I look for. Because if somebody thinks that they know more than me, which granted, they could, you know what I mean? Like, I'm not the end all be all. But, if I'm interviewing an intern or an associate and I feel like they're not open to what I have to say, then what's the point of bringing them on?
Right.
And not that like everybody has to agree with everything that I say like at all, because I tell you guys all the time, like I don't know all the answers and like I'm gonna be wrong at points, and like let's have a conversation about it. But if it's just the I'm just kind of like dismissing it as like the intern or the associate, then it probably isn't gonna work here.
Mm-hmm.
And also the flexibility and adaptability. And I know that's something we've been talking about with, you're coming up on graduation and you're staying on with me and I'm so excited. But,
Mm-hmm.
trying to be adaptable as you're building up your caseload, where you might be working more like mornings or evenings or kind of scattered, or maybe like a weekend day or things like that, which we don't want forever, but just as you're building that adaptability and that flexibility to accommodate clients that are coming in. And so if I have somebody who's like, yeah, I'm not willing to work like nights or weekends or this, it's like probably isn't going to work for the clinic, for the practice. Because like even I work nights.
Right. Right.
Mm-hmm.
And having that openness. And I feel like that is also something that is very different from like private practice environment versus agency.
Yeah.
And so it's been cool to get to hear about my cohort members and just people that I know that have had their internships in agency, and just the very like very, very procedural, very like clear parameters, which I think for some people and personalities, they almost like prefer that versus some of like the ambiguity and having to, you know, be a little bit more flexible. But it is really interesting in terms of hearing about just what they're getting from a supervision standpoint as well, just because some of them are like, you know, they're government funded. There's a lot more layers to what they're able to do for clients, and honestly, like also like what they're able to say in sessions, and it's a little bit less. And because I know you've had experience in all the things, so I'm curious what that was like for you. But for me, I'm like, whoa, I have like really never had an instance in supervision where I'm sharing what's going on in a case, and I'm like sharing, okay, Manon, like I want to kind of walk you through what I did, and I want feedback. And I don't think I've never had a time where you've been like, that was a horrible thing you said.
Never. Oh my gosh, I would never do that.
No. Or like, okay, you can never do this. Like you have to respond with these very like kind of scripted out things, which for an agency environment, like I totally get the ramifications of maybe like going outside the lines a little bit. And so that was something where I was like, whoa, like such a benefit for me and like my personality and how I work, of like having some of that creative freedom within, of course, like all the ethical and legal realms. But like thinking about that experience of like how you develop as a therapist when there are so many of those parameters, I'm curious what you've seen with other people.
So when I started forever ago, being an associate or an intern in a private practice, I don't think was an option.
Really?
Temporary license didn't even exist. I'm telling you, this is from like the dark ages. Like I've been around a while. The Botox is doing me a lot of favors at this moment. So, but like, so I think I graduated, and I think I was practicing. I graduated in 2005, and I didn't get my associate license till 2006. So I had a year where I wasn't getting any hours towards licensure. And in that, I was working in a residential program. So it was a deferral program for kids. So instead of going to detention, they would come and do treatment. And that I loved. Like, it was so helpful. And I actually really loved the program model that they had. And it was a lot of kids with like substance abuse, but it was really close to what my internship did. And so it was great. And then that one lost its contract, and so everybody got laid off. And so then I moved to like a different residential place that I hated, because it was all about profit. It was all about like, how do we keep the kids here the longest so that we can make money? And as a therapist, like, that's not why I do therapy.
No.
And so I learned a ton, but there was a lot that like I couldn't do because either not the private practice, the residential facility, or the like payer source, so if it was an insurance company, or if it were like a REBA, or a regional behavioral health agency, or a TRIBA, a tribal behavioral health agency, they would control a lot of what we could and couldn't do, and also like how long the people could be in the residential setting. I worked at a hospital. I hated it because it wasn't therapy. It was like case management, not my jam at all. And I had to be there at 8 a.m. That was really early. So no, thank you. And then I did work at I ran a program at Sage Counseling, and I actually really liked that. But it was one where we were contracted with DCS. And so it was very prescriptive of like what we had to do for billing. But then there was freedom with like what therapists could do to meet the family's needs. And so I liked all of that. I did feel like when I made the transition into private practice back when I worked at Therapy with Heart, and like Rachel Thomas was great, and that was such a great setting to start in, but I felt like, I'm like, oh my gosh, like I felt kind of like you, and I think probably like Adir, like new therapist starting out, even though I'd been practicing. I'm like, what do I do? And like, I'm charging people to like talk to me. Like it was just this whole learning curve. So while I feel like I learned a lot, it was like, how do I apply it now to private practice?
In a completely different setting.
Yeah.
And so, because I feel like there have been discussions amongst like interns in my cohort of, for people at agency, do they want to stay in agency for hours or different logistics or like the scheduling of it, or private, transition to private practice and sort of those discernments. And so like, what, I guess, any advice you would give to like an intern that's determining between the two of what to do in their associateship?
Well, I don't think it has to be either or.
That's true.
I think, clients can... I got to notice that my internet was unstable, so let me know if I disappear.
Okay.
So I don't think it has to be either or, because like I was working 3 jobs when I was an associate license. So I worked at a residential facility. I worked outpatient part-time. I worked another outpatient, I was doing private practice part-time. So I was doing all 3. And so I do think that there's a lot to learn from both, where, in an agency, you're probably going to learn a lot about different mental health disorders, different, presenting concerns, working with psychiatrists, working with case managers, having more of this collaborative care with other providers can be really helpful. I learned a ton from psychiatrists that I worked with when I worked at like my second residential place, and I feel like I still use some of that stuff today. Whereas what like private practice, it is a lot of like figuring out who you are and your style, and so that can be really fun and really overwhelming. But I think if there's a way, like if you have somebody in your cohort or somebody who's listening to this later that's like, I don't know what to do, I would say explore both options. And unless you're starting with a private practice that's contracted with like every single insurance company and has like a waiting list, like you're not going to hit the ground with like 80 clients. You will at an agency, but you could throw in like a couple days maybe at a private practice and start to build up that way too.
So balancing both, and then as you're in your associateship, get to learn from both environments and then decide after what makes the most sense.
Yeah. And I think, I always go back to the vibe, like how's the vibe of the agency? How is it with the supervisor or the supervisee? Are they wanting to do the same work that like I'm doing, and like going back to your question, like I want people that want to work with trauma because I love doing trauma work. So if somebody's like, oh, I hate doing trauma work, again, probably not going to fit what we're doing because we're all so trauma focused. But I think really interviewing who's going to be your supervisor. How does that relationship feel? Because just like, you are with clients and it's like human first, therapist second, it's like there has to also be a connection here to feel safe, to talk about like, I don't know what I'm doing with this client, or I messed up, or any of that stuff. And with agencies, sometimes there can be a lot of turnover just due to funding or different things like that, or like productivity, where, that would be a question I would ask is like, are they going to be my supervisor? And for us as MFTs, do you have an MFT supervisor that I can work with? And making sure that they've done the supervision courses, that they've done supervision before, and like all of that stuff. And I think another thing that I would ask would be, what's productivity? Because like, I don't have productivity for you guys of like, here's how many sessions you have to do in a week or in a month. But some agencies do because it's billable hours.
Okay, so kind of leaning in, and as the intern or the newer associate is like exploring different avenues and talking with the supervisor of like, how do you define, what do those metrics look like, or productivity, so that they have a really clear idea and you're not starting somewhere where it just doesn't feel aligned for you. Yeah.
There's one practice in the Valley, which I won't out by name, where the owner does productivity for her therapist, and it's a private practice. Not me. And nobody that I'm like friends with. We'll just put that out there. But she has productivity, and if her therapists don't meet it, they have to pay her the difference.
Really?
Mm-hmm.
Oh, geez.
So if like you, let's say, went on maternity leave, not that either one of us are pregnant, but like if you went on maternity leave and you were working at this practice, productivity would still count. Yeah.
Oh, wow.
Mm-hmm.
So those are things that if you don't ask, if you don't ask, you
Yeah.
wouldn't know until you're already there. And I think that because ASU's program, which is the program I'm in right now, the master's,
Yeah.
their accelerated masters for MFT, they did sort of like a match program
Mm-hmm.
where we filled out a form of like preferences. And I think my first one, when they were like, what, types of presenting problems do you want to work with? I was like, trauma. I want all the
Yes.
trauma. Yes. Like I want all of it. And
Yeah.
I feel like I was, pretty open in regards to other things, but that was one that I know there are some practices that just aren't as big on like EMDR or brain spotting. And it's more so,
And that's okay.
Totally okay. And so that was something that I knew I was very excited about. But we couldn't, like, in our process of our program directors, Amanda and Darian, because they work with the supervisors and do a lot of like the back end, they sort of set us up in like a match sort of way where then we interview and go through the process, figure out if it makes the most sense. But I know in other programs and other schools you're kind of expected to find your own internship site. Is that sort of the norm, to find your own versus being matched?
I don't know, because I was matched at mine, and I went to the University of San Diego, and so we did a similar thing where we like filled out, I think we could interview, I think, up to like 4 places.
Okay.
And then we ranked them, and then they would do the same thing. And so then based on our rankings, then they would match us that way. So theirs was a little bit more kind of in depth, but like I know GCU, you have to find your own internship. I don't know about Fuller. Fuller, you might actually have to find your own internship too, now that I'm thinking about it.
Fuller, so, you do.
Yeah.
But they have, I think they do like an internship fair where they have like a bunch of supervisors come on site and then you reach out and so I think just hearing about how different schools do it, but I imagine, I got so lucky with them introducing us and like matching us in that way where I'm like, Amanda and Darian, you crushed it.
Yeah.
But I imagine what were you gonna say?
I was gonna say they did a good job. That was all I was gonna say, but keep going.
Yes. And when like I imagine that if I had to find my own, there would be, as an intern, like such a large sea of different people you could reach out to, and like knowing what questions to ask. So I feel like as an intern, and again as I'm like getting close to the end of my internship and very excited to stay on with my internship site.
Me too.
Which I'm so excited about. I think like what I would tell other people that are either starting an internship or like exploring it is really like, yes, think about the practice and the things that they offer, but what you said, Manon, of like, you really have to like trust your supervisor and feel super comfortable, because there are going to be so many moments where you're just like, I don't know what to do here, or like I need help figuring out where to go with this client. And I would imagine that if we weren't comfortable with each other and I felt like, oh, I don't want to, say the wrong thing, or just trying to like be a certain type of like intern with a practice, that would be such like a detriment to my growth of just not being honest about what's going on,
Well, and how sad for the clients too, because it's like then everybody's stuck. So
yeah. And so that's just something where I feel like having those questions for your potential supervisor, like understanding their style, understanding like the practice's culture and what like they're looking to grow, and different like logistical opportunities too. There's, I imagine, a lot for people that have to figure that out for themselves.
Oh yeah. Well, and I always go back to like intuition, which I know is not therapy or supervision, but really trusting my gut on like who is going to be a good fit. Clients, therapist, and all kind of aspects of my life. And if there's anything that's kind of signaling like I don't know about this, really leaning in and exploring it. And that's something that I talk to you guys about too with like clients. That's also what I would tell people who maybe are like interviewing for an internship or a job after graduation, is like trust how your body feels when you're talking to the supervisor or the hiring manager, or even when you show up to the building. What does your body tell you? Because it's going to communicate if we listen to it.
And just be aware of those things, and like being really intentional, knowing that you're going to spend like a lot of time with this person. And what I was told in my program is your first supervisor is going to be so formative, or is so like
so
helpful in like the in the formation of like who you are as a therapist. And so be really intentional like about your interactions and like allow them to see you as like the authentic person and therapist that you are, so that they can help you. Like they're not looking for you to be perfect right off the bat.
Ever. I'm not ever looking for you to be perfect, because I'm not ever going to be perfect. So I try not to expect anything from you guys that like I don't expect with myself.
And that is and that is something as your intern that I feel like that is the feedback I always give to my cohort members, like my program directors, of like, Manon would never ask me to do something that she has not already done or like wouldn't do herself. And that is a big, because I come from a background like working in more of like the before my grad program, working in like sales and like the business development side of things. And there were a lot of like transactional relationships just based on the nature of it. A lot of like, I'm going to ask you to do something without necessarily like them having done it or would do it, which is fine for that environment. But I feel like for me, and I'm curious what you saw with me, like as I was, you know, getting my little sea legs or land legs, whatever the saying is, of like kind of unwinding some of that like corporate view of like, okay, this is how I'm going to show up as an intern and this is what I'm going to do and la la la, and just kind of stripping it back of like, okay, that's like not the environment for therapy or private practice at all.
I do think that background helped you in the beginning, because I think it's like, I think doing kind of like corporate America, like you would have to like show up and be confident. And so I think you were able to, you know, with like your first few clients, not that like you weren't excited, but like kind of like hide some of the like anxiety, right? Or the like, oh shit, what am I doing? Like, I think I know what I'm doing, but like now it's time to like actually put it into practice. And so I think that gave you kind of like a good, I don't want to say a mask because you weren't masking, but I think you were able to kind of walk into it and be like, okay, like I've got this. And, you know, and all the other things that we've talked about of like, I'm just making a connection, I'm exploring, I'm being curious, like, okay, got it. And I think it's also helped you with some really hard conversations where we've had to maybe refer, like that one family that we were talking about where we had to refer them out. I think being able to be in corporate America really helped with that.
Now that you're saying that, I'm like, okay, I take that back. I think so too. There were some things, I think so too. And I think just even like, I remember the first day, like as I'm walking in, and you had an intensive session. I remember.
Oh yeah. I think Lucy and I did, didn't we?
You and Lucy had an intensive session, but everyone messaged and they were just like, you're going to do great. Like, have such a good first day. Like, you got it. And I'm like, I do got it. But I remember before I met with my first client, I had like a moment where I was like, this is like the last first day in a job.
Yeah.
And like, that felt so special. And like, I don't know, I was like very grateful. And I was like, you know what? Like, I'm just going to show up, do what we've been practicing, and it went like, I thought it was very energizing after, like the nerves I think kind of went away. And I'm wondering if that was also part to like having a job before where it wasn't something where I like long-term would have been fulfilled, of just recognizing like I am in the right seat and I am ready to learn. I gotta just be along for the ride.
Well, and I think you sent me that message like right after that session, or maybe we checked in afterwards and like you told me that, and I was like, yes, like it's good.
It was good. It was good. So I think like for interns, like the first day you're gonna have nerves, of course, but I don't know, view it. I had to talk to some of the new cohort at ASU, which was so fun, and they're all like so nervous and excited about when they go to their internships. But that was something that I said of like, view this as like the first last day of something new that is going to be so like transformative for you, and like allow yourself to be present in the moment and trust that you are just learning things about them, you know, the first session.
Well, and the like therapy is always evolving. What we know about the brain, the nervous system is always evolving based on more research. So like yes, as an intern or a grad student or a new associate, it is brand new. But even for somebody who's been doing this for a while, like I'm still learning. I'm still growing. I'm still developing. And part of it is like we have to do so much continuing education every 2 years. And so even in that, it's like, I might have done this training before, but it's like, oh, that landed differently for me, or that's something I really need to like take away from it. Where like EMDR, the way that EMDR is trained now is very different than the way that it was trained when I was doing the, like, going through the training. And so everything's evolving. And that might be something else I would tell like new interns or grad students or new associates of like, just because this is how it is right now, it's going to keep building, right? Like you're going to keep scaffolding on it to just get better and better and better and more fine-tuned into who you are as a therapist and who your ideal client is, what, you know, modes of therapy or models of therapy that you want to use. And nothing's stuck forever. Like you can always change.
Which is huge. Of like, you're gonna be learning everything new, but even as you develop on, there's gonna be more things. And I think that's what's so like exciting about the field.
Oh yeah.
Yeah, is it's just like there's nothing that is static. And you get to, I think what you said earlier too, of like what you look for in interns and just like people at your practice in general, is just like their openness and willingness to learn and like receive feedback and adjust. I think that goes into also like the forever learner mindset of,
for sure,
I want to be open to what's going to best benefit the clients too.
Yeah. Well, and that's, I mean, that's the only way to do it. Because if we came in and we're like, nope, this is all we're doing, we're only doing CBT and nothing else, we wouldn't really be able to help every single individual or couple or family that comes in.
That's true. That's really true. And that's maybe something like, as we're wrapping up this podcast, this little discussion, there's a lot of talks about like purists of, okay, people that just use...
I made such a face at that. I don't know if we should do this as a video or just a podcast, because I don't even know what face I just made, but I like felt it after I made the face. Okay, sorry. I'll control my face.
No, you're perfect. You're perfect. It can always be audio. It can always be audio. No, I'm kidding. But that is something that I feel like very grateful for as like I'm at the practice. There's so many different modalities that we constantly, it's less so about like what modality are we using and what is the client needing and what can we sort of like piece together in this tapestry of like treatment that is going to benefit them. And that is something I feel like I would tell interns moving forward, is be aware and like ask questions about the practices modalities, like if they are more of that purist and have like one or two interventions or modalities or theories that they really focus on, or if it's more like you're catering it to your client, because I think that also really changes, at least from like a supervisory experience. If I imagine there's like, again, a couple people that I know that have had a supervisor that was very purist in like structural therapy or just EFT or just one, which is totally fine for what they're doing. But I feel like as an intern, it's really helpful to get to hear like, okay, what did you pull from narrative? What did we do in brain spotting? What's this other thing in EFT? So
well, and I think when you had started, I said, you know, maybe pick a few and like practice them with clients. See what you like. And, you know, and kind of like, and that's going to develop your style, your vibe, the models that you typically will go to for different therapeutic models or intervention. But I don't feel like there's a person that it's like one thing cures all of it.
Right.
You know, even with EFT, and I love EFT. I think EFT is an amazing model. So for anybody listening who doesn't know what that is, it's emotionally focused therapy by Dr. Sue Johnson, who I met and fangirled over. Maybe I'll post a picture in like the comments of the podcast. We'll see how brave I get.
You certainly should.
Excuse me. My allergies are like killing me right now with all the weather changes, but
I know.
EFT is great. It's like fantastic. Like that is probably my favorite couples therapy model. However, there are some couples that will come in and are like, we want resources, we want tools, we don't want to do all of this like enactment and like going deeper into emotions, like we need something now. And EFT doesn't have a lot of here's what you can do now in terms of like Gottman, you know, model for couples therapy does have a lot of homework, does have a lot of resources. And so sometimes it's being able to stay very EFT focused, but then bring in Gottman. Or, you know, I think a lot of what we do as MFTs, because we are systems therapists, we look at the whole system, that's going to be our foundational approach, is like systems theory, attachment theory, and then we build from there. And that might not be for everybody, and that's okay. And like if somebody is really into structural, that's great. I think structural therapy is amazing. There's a time and place for it. Just like
Right.
DBT, just like IFS, just like EMDR, brain spotting. But I think it's, again, trusting your clinical gut of, is this what my client needs? And are they
Right.
ready for it? Like, are they motivated for it?
Mm-hmm. That's huge. And a lot of that discernment is just, again, comes with time, which
Yeah.
is easier said than done, but
Yeah. And I think just trusting that, and this would be what I would say, not only to you, I think I have said it to you, but anybody that's listening that, again, is like starting out as a therapist, but like trusting that you were called to this field for a reason, right? You were called to be a healer for some reason. And so at the end of the day, trusting that as a human, you're going to be able to hold space for somebody and like figure out, okay, what interventions do I need to do along the way? And it might shift, it might change, and that's okay. It's not like you have to be stuck in one lane the whole time.
that was a good mic drop in on.
Yes. All right. Well, that's where we end then.